Hi, everyone. I'm Colleen, and I'm back for another live stream brought to you, of course, by the awesome people over at Princess Dental Staffing. Happy to see you on this blustery Wednesday. It's a little bit cold where I am. Hope you're staying warm where you are. So today's topic, we're talking about how to treat patients with dental anxiety. So we've actually touched on this on a lot of previous streams, right? We've talked a lot about the fact that a lot of patients experience some form of dental anxiety, right? Some of them, experience just kind of that nervousness when they have to go see the dentist, even if it's just for a routine cleaning and in your routine checkup. Sometimes it can be really daunting to the patients. And as a matter of fact, some studies show that up to 36% of the population experience some form of anxiety when they have to visit the dentist. And some studies even say the number is higher than that. So it's pretty safe to say that a third of the patients that you're seeing on a daily basis are experiencing some form of anxiety. And of course, anxiety, is kind of a range, right? There are different forms of anxiety. That might mean that some patients come in and they just feel a little bit nervous or a little bit insecure. And some patients might come in to see you and they just are incredibly fearful. They may even have a phobia of seeing the dentist. So, at least a third of your patients are experiencing some form of that, or they're somewhere on that spectrum, right? They're somewhere in that range. So as a dental assistant or a dental hygienist or a dentist, you're really going to want to do your best to help alleviate some of that anxiety for your patient. And so today, like I said, we've talked about this in previous streams before, but today we're dedicating an entire stream to talking about your patient's dental anxiety, reasons for it, and what you can do as the dental professional to help alleviate some of that anxiety, which of course can lead to better patient oral health. Okay. And again, this stream is brought to you by Princess Dental Staffing. Princess Dental Staffing is an online dental job board. They have positions available for front office personnel, dental assistants, dental hygienists, and dentists in a variety of different areas. They're offering full-time, part-time, permanent, temporary positions, and a lot of different locations. So if you have some time today, hop on to princessdentalstaffing.com, check out their job board, and see what they have available in your area. You can also, while you're there, you can also create a profile and get your information in front of hiring managers and decision makers. And you can also check out their blog. So their blog covers a lot of the same topics that we cover in these live streams. So be sure to check that out as well. And speaking of these live streams, we bring you these live streams every Wednesday. Every week, we're covering a new topic, talking about your career in the dental industry. So if you don't want to miss out on future streams, be sure to follow our page or subscribe to our channel. If you have any thoughts or insights, or you want to contribute to the conversation, comment below. And if you like any of the information that we're bringing you find it really helpful, be sure to drop us a like. Okay. And of course, if we couldn't get to your comments when the stream was live, of course, we will respond to you as soon as possible. Okay. Okay, so back to your patients with dental anxiety. Let's start off by talking about what causes dental anxiety. So why are over a third of your patients feeling, really feeling the squeeze of anxiety? Well, there are a couple of different more than a couple. There are several different reasons. First of all, it could be associated with the fear of dental cleaning, right? Because sometimes dental cleaning can be a little bit painful or uncomfortable for the patient. Now, as a dental professional, I'm sure you know that if there's a lot of pain or discomfort that is being experienced by the patient, it's likely due to improper oral hygiene. Right? It's like if you have to spend more time cleaning and getting into crevices and the patient has to feel that discomfort or that pain, it's likely because they're not employing a lot of the healthy practices that they need to employ in order to keep their oral health where it should be. Okay. But of course, the patient's not thinking about that, right? That's not what the patient's thinking about when they're sitting back in that chair and you're working in their mouth. They're thinking this hurts and this is the person that's hurting me. So they're associating that anxiety with not necessarily with their oral hygiene habits, but with you as the dental professional, unfortunately, right? Logically, we know they're likely to experience less pain if they take the time to integrate those good oral health habits, but that's not kind of what they're thinking about at the time. So that's why one of the reasons why patients associate that pain, or they experience that anxiety because they're associating that pain with going to the dentist. And that can lead to patients, not coming in for their routine cleanings and checkups, which can lead to further detriment to their oral health and therefore overall health, right? So that's definitely something that's definitely one of the reasons for the anxiety, and it's something that really has rippling effects, right, to their overall health, right? Another reason that patients experience anxiety is fear of the unknown, right? As human beings, we all have some fear of the unknown, right? Like, for example, some people don't like to go to the ocean, or if they go to the beach, they don't like to get in the water, right? Because they can't see what's under them. They can't always see what's there, and they're not always aware of what's around them. And that fear of the unknown can be anxiety inducing or fear inducing, right? And when it comes to dental patients, they can't see what you're doing in their mouth, right? They can see you working in there, but they can probably feel it, but they can't see it, and they don't necessarily know why things are being done, the reason why certain things are being done to them, right? Or they have to go through certain procedures or processes. Okay. So that's another reason why potentially, patients can feel that anxiety, because they don't know, or they don't understand what's happening and why. Okay. Um, Another reason for the anxiety is that their teeth might not be in very good shape. So, the last time you saw a patient, maybe you told them, "Oh, you should really floss more often. You should floss, or maybe you should floss more often." And maybe that patient had the best of intentions when they left your office and thought to themselves, "Yes, I'm going to floss more." And then maybe it just didn't happen because they forgot. Guilty. Completely guilty. I should probably apologize to my dentist and my hygienist as well. But sometimes, we have a lot of things going on in our lives, and sometimes oral hygiene is just not at the top of our priority list, because other things just kind of, as a patient, some other things have our attention, and maybe they forget, or maybe they just don't really know how to implement some of those healthy habits that can prevent them from having extra procedures, or having to incur that pain associated with cleaning when they have to have like a deep cleaning because they weren't employing those healthy habits. Okay. So again, it can be very anxiety ridden, not only because they might need a deep cleaning, but also they might have to admit to you that maybe they made a mistake, or maybe they forgot, or maybe they haven't been doing something correctly. It's really hard for any human being anywhere to admit that they did something wrong, or that they made a mistake, or that they forgot about something. Right? It's always a difficult thing to become humble and admit those sorts of things. So sometimes they might feel a little bit anxious because they have to tell you that they did something wrong. Okay. So those are just some of the major reasons why patients experience that dental anxiety, if they are experiencing dental anxiety. So let's talk about, as the dental professional, some things that you can do to kind of help alleviate some of that anxiety. First of all, professionalism, making sure you're maintaining your professionalism. Okay. Patients, patients are more likely to trust you if they believe that you're a healthcare professional, and that you actually know what you're talking about, and that you know your stuff, essentially, right? That you they are more likely to trust you if you establish yourself as the subject matter expert. And the way that you can do that is by maintaining your professionalism while balancing it with sort of a friendly and welcoming attitude and demeanor, right? it's important to remember that you are the trained dental professional and you are the subject matter expert. So one of the ways that you can tackle that anxiety is by explaining to patients what's happening and why. Okay. So just kind of giving them a heads up as you're going through cleanings and you have to switch different areas or different focuses, or you have to take care of something. It's a good idea to let the patient know. It's also a really good idea to explain certain processes and procedures to patients in layman's terms, right? In simplified terms to where, they can understand it. Someone without any dental training can understand what's happening and why. Okay. So that's one way that you can kind of help alleviate uh, their anxiety. So a few other notes about, maintaining that professionalism and that professional demeanor. You want to make sure that you dress professionally, and you want to make sure that you keep your operatory in a professional state as well. Okay. So when talking about the operatory, you want to make sure that everything is clean and organized and everything is where it should be. Because if the patient walks in and everything's just kind of a jumbled mess, or and everything's kind of all over the place, it's going to make them feel even more. If you put them in a kind of chaotic environment, it's going to make them feel even more anxious, right? That's just kind of how we work as human beings, right? So you want to make sure that your operatory is in a clean and organized state. And when it comes to your apparel and your uniform, you want to make sure that you're wearing a clean and wrinkle-free uniform. Now, depending on your particular office, they might have a dress code, and they might actually say what kind of scrubs you can wear and what you should kind of stay away from. They might have an actual dress code. Some offices have a specific set of scrubs they want you to wear, like a uniform scrub, so everyone looks the same. And some offices allow you to kind of choose what you want to wear. Sometimes they prefer solids, or sometimes they allow prints, but just make sure that your scrubs, depending on how much control you have over what kind of scrubs you wear, make sure that you're wearing scrubs that are appropriate and, again, clean and wrinkle free. Okay. And that will contribute to the overall professional demeanor that you present to the world. Okay. All right. Some other things, make sure that you include the positives, right? So again, some patients might experience anxiety because they have to admit, maybe I haven't been flossing as much as I should, or I didn't do that thing that you asked me to do. And nobody likes to be scolded, right? Nobody likes to feel like a scolded child. So, be sure to take the opportunity to include some positives when you see that patient, right? So, like, for example, if you're reviewing their previous charts, and you see that their oral hygiene is looking better from the last visit, be sure to mention it. Be sure to let them know, hey, things are looking up, things are looking better. That thing that you're doing, is obviously working. Or if they just had like oral surgery, let them know if things are healing well, right? And things are looking like that the surgical site is looking like it's healing well, and that everything is coming back to normal. Okay. It helps build the confidence of patients. It helps them feel more comfortable, and it helps them feel less like a scolded child, right? Um, uh, and not only that, but letting them know that you're seeing improvement, and that and letting them know kind of what's going well is a really great way to, again, build that confidence, but it also helps motivate them to keep doing what they're doing. Continue to employ those habits that are contributing to their oral health, and by extension their overall health as well. Okay. All right. So let's do a quick recap of what we discussed today regarding patients and dental anxiety. So there could be a lot of different reasons for dental anxiety. It could be, fear of the unknown. It could be fear of pain, or it could be fear of admitting that you made a mistake, or that you didn't integrate the the recommendations from the last visit 6 months prior. Okay. So there could be a lot of different reasons for that dental anxiety, but as the dental professional, you have some control over, you know, um, factors that can help make the patient feel a little less anxious and really help quell that anxiety. Okay. For example, professionalism. Make sure that you present that professional demeanor to the world through your attire, through how you keep your operatory. And again, it's important to remember and have confidence in the fact that you are the dental professional and that you know your stuff and that you know what you're talking about and that you're able to communicate um, complicated dental processes, procedures, and jargon to the patient in a way that they can understand. And that can help really alleviate their anxiety. Additionally, being sure to include some of the positives about the visit. So, making sure to note that the patient's oral hygiene or oral health looks better than last time, or maybe, talking about how certain things are healing up if the patient recently underwent oral surgery or underwent a process or procedure. Okay. So making sure to take note of some of the positives and some of the good things that the patient is doing is really going to, again, alleviate the anxiety, build their confidence, and help motivate them to continue employing those positive dental oral hygiene habits. Okay. Okay. So that is all. Those are all the things I want to discuss with you regarding your patients and dental anxiety. Thanks for tuning in today, everyone who did tune in. And we will be back next week with covering another topic regarding your career in the dental industry, our tips and insights on your career in the dental industry. So in the meantime, everyone, I hope you have a great week. I hope you have a great weekend. I hope you continue to stay safe out there and stay warm out there as well. It's starting to get kind of cold, so stay warm as well. And I will see you soon.